Hello everyone, my name is Dr. Ankur Khandelwal and welcome back to my channel. Today's video is not for patients. Today's video is specifically for MBBS students, postgraduate students, residents and other paramedical staffs. We often come across patients who have certain spine disorders. And there are certain terminologies in spine which we confuse very often. So let us resolve these confusions today. So number one is a confusion between what is a dermatome versus what is a myotome. So what is dermatome? A dermatome is an area of the skin supplied by a single spinal nerve, right? A dermatome is an area of the skin supplied by a single spinal nerve, whereas myotome is a group of muscles. It's a group of muscles supplied by a single spinal nerve. Correct? So this is dermatome versus a myotome. Second, what do you understand by radiculopathy versus radicular pain? Radiculopathy versus radicular pain. So what is radiculopathy? Radiculopathy results from the compression of the spinal nerve, whether be motor root or the sensory root, and resulting in sensory as well as motor symptoms. Sensory symptoms like tingling sensations, certain paresthesias, burning sensations, and motor symptoms like weakness of the muscles. So this is radiculopathy, where you have compression of the single spinal nerve or a nerve root, either the sensory or the motor, resulting in sensory and motor symptoms. Correct? Whereas radicular pain is just the pain in the area of the distribution of the spinal nerve which is compressed. Here typically you get only the pain in the area of the distribution of the compressed nerve, right? But not sensory symptoms as well as the motor symptoms. So radicular pain is just the pain, whereas radiculopathy comes along with pain plus sensory and motor symptoms. Third one comes the radiculopathy versus a myelopathy. So radiculopathy I have already explained, it's the compression of the nerve root, either the sensory or the motor, resulting in pain, sensory as well as motor symptoms, right? So radiculopathy is typically leads to lower motor neuron symptoms. Radiculopathy typically leads to lower motor neuron symptoms. Now comes to myelopathy. Myelopathy is typically results from the dysfunction of the spinal cord, either by compression or non-compressive pathologies. Remember, myelopathy means the dysfunction of the spinal cord resulting in motor symptoms as well as sensory symptoms, but this is due to the dysfunction of the spinal cord. Compressive myelopathy, it could be because of certain disc lesions, spondylolysis, like such pathologies, whereas non-compressive symptoms can be because of myelitis, some tumors, arachnoiditis, all this. When radiculopathy typically is associated with lower motor neuron symptoms, myelopathy is associated both with upper motor neuron lesions as well as lower motor neuron symptoms. Correct? And lower motor neurons are usually a bit of less frequent as compared to the upper motor neuron symptoms. And in the lower limbs, upper motor neuron symptoms are more prominent as compared to the lower motor neuron symptoms. So you typically see spasticity when there is a myelopathy because of the upper motor neuron lesions. You see clonus, you see plantar extensor. So these are the symptoms of myelopathy. Whereas most of the radiculopathy can be treated conservatively, myelopathy is usually most of the time it requires surgery to relieve the symptoms of spinal cord compression and canal stenosis. Correct? So today I have discussed three most important things: dermatome versus a myotome, radiculopathy versus radicular symptoms or radicular pain, and the third is radiculopathy versus myelopathy. I hope I have brought some insight to all my viewers regarding these important terminologies. Thank you so much.